Hey guys, Dr. David Arn here with a quick video. Here are 2 tips to get some more flexibility out of some of those stubborn muscles. So I have a history of an injury in this right hip from playing soccer, so it's always a little bit stiffer. So I'm going to demonstrate how I kind of work through some of that stiffness. So going into a butterfly, so you can kind of see how this one always already stays up a little bit higher. I can lower this one, left one, and I can lower the right a little bit, but not quite all the way down. I can push the left pretty much almost to the ground, and the right kind of gets stuck right about there, and I feel the pull in my adductors. Okay, I lowered the camera a little bit so you could see better, but you could see how this right hip kind of sticks up higher. I can push it down a little bit, but I can feel how restricted that is. So what we're going to do is work this right hip adductor. So I'm going to put my left hand behind me. I'm going to use my right hand. I'm going to go push into a stretch as far as I can, and then when I get to that end range, I'm going to push up and hold it for 5 seconds. So 1, 2, 3, 4, 5. So really resisting this motion with my hand. And then I'm going to push further into that stretch so I can get a little further now already. And then I'm going to do it again. Push 1, 2, 3, 4, 5. And then I'm going to push, and I'm going to hold that, trying to relax the leg for about 20 seconds. Okay, and then I'm going to relax. So even already you can see I can get that almost all the way to the ground. Then looking at the other side, it's about, so the left can get to the ground, and now the right can get to the ground. So that first trick was called contract relax. It's a PNF technique. So really what we're doing is pushing down in that tension, the 5-second hold of resistance, about 50% kind of moderate resistance, is stimulating what's called the Golgi tendon organ, which is in your tendons. Essentially those tell your muscles to relax with that sustained tension. So by holding that, we're able to relax the muscle and then get into a deeper stretch. So that was the first one. Now that we have that motion gained, we have to work to contract our muscles on either side of the joint in that new motion, so we're able to maintain it and gain that motion permanently. So what we're going to do is work down into that. I'm going to put my hand behind me again, push down into that space again, so that new motion, getting down to the floor, and then I'm going to push up. I'm going to hold for 5 to 10 seconds. So doing about that same moderate 50% contraction, and then relax. And then I'm going to go to the other side, and I'm going to push down towards the ground, trying to stay in that new range. So I'm just going to alternate back and forth a few times. Okay, so now I've done 3 of each. So now I want to test, look how I can do with my left, and now look how I can do with my right. Kind of working up into that range. I can probably even get a little bit closer, testing the left, going down to the floor, and then testing the right. Now that it still wants to stay up here, but I'm able to push it down with a little help. So if stretching isn't really getting you anywhere, these are 2 good techniques to kind of work through some of those stubborn muscles that don't want to loosen up by contracting and then relaxing, and then working the motion in both ways. So contracting in both directions of the joint, really to teach that joint and the muscle that it's okay to be contracted and it's okay to work in that new space, because muscles really like to tighten up to protect either the muscle or the joint, and that can cause a lot of stiffness and cause a lot of pain. Thanks for watching. If you found this helpful, please like and subscribe. I would really appreciate it, and then you would really help out my channel.